Hi there. Thank you, Jerry. Good morning, good afternoon, good evening, wherever you are. Thank you, Jerry, and nice to meet the panelists and the fellow speakers. Ryan Delarami, founder and CEO of TeleVue, and here we're building an ecosystem of connected care using AR, VR, AI, and IoT devices. So let me share a story with you around the technology first. So Priestville is a town in northern Saskatchewan, which is a province in Canada. And this town has a population of 1,000. And if you Google this town, the first thing that comes on is an Esso gas station. So you know how small this town is. And beautiful city, one hospital, one ER. The closest ER next to this is 50 kilometers away or 30 miles away. The closest ambulance company is 40 kilometers away. And there's a patient in this city that has, or in this town, that has a severe anaphylaxis. So you can imagine how the parents of this patient, young patient, are nervous about receiving care for their young children. Lots of studies around lack of access in urban, rural versus urban areas. And I'm going to share you this study from University of St. Louis and Harvard Medical School, which shows rural areas have 40% higher preventable hospitalization as compared to urban. And mortality rate is also up by 23% compared to urban. And if you just have as little as one specialist visit to these communities per year, that's going to dramatically reduce those rates by 16%. So you're going to have less preventable hospitalization and less mortality rate. This is huge. Lots of data in CDC to support that. And again, this is not just a rural area. I brought up that example just to say that it's exacerbated in the rural areas, but urban areas are suffering from the same sort of effect. Unless you're living in a large city with access to healthcare right in your neighborhood. Now, if you go to Africa, this story gets even worse. You got 18 physicians per 100,000 patients, or population rather. And just to put this in perspective, sub-Saharan Africa has a similar population to Europe. And in Europe, we have 1.7 million physicians serving patients. So it's a huge discrepancy between the two. When we hear 30 under 30 in North America, we automatically think about something. But in Mozambique, what that means is there's less than 30 surgeons for more than 30 million people. So the lack of access to surgical skills or surgical procedures is killing more patients than HIV, TB, and malaria combined. So the solution is obvious here. We have to have some sort of virtual care, and the pandemic has obviously shown us that this is the way to go. Now, during the pandemic, everybody was creative. We used our tablets, we used our phones, we used our computers on a wheel. We used pretty much everything we could to bring care to the patient virtually without having to be in contact with them. But as you can imagine, this is not the right solution in a healthcare setting. You need your hands free, you need your hands clean, and showing a patient's ECG with a tablet in front of the screen is not the way to go. Now, some other companies have come to market with different ideas, like a robot here or a station in the OR that allows you to visualize what's going on. But again, as you can see, real estate in these kind of settings is pretty prime, and you can't just occupy the room with expensive equipment that are cumbersome to move and really hard to navigate. So our focus has been on delivering a solution that is patient-centric, it's safe, it's effective, it's efficient, it's easy to access, and it provides timely care. And most importantly, is it's scalable, because equity in care comes with scale. You can't just have a solution that is expensive and limited to some centers around the world. So what we focused on is faster clinical decision-making and leading to improved outcomes. Along the line, we realized that there's reduced healthcare costs, there's improved efficiencies, there's patient satisfaction that has increased, and integration with other technologies that brings other opportunities. I also want to plug in the human integration, which is a very important factor. So integrating with technology is great, but unless the human side of things are integrated, it's not going to improve healthcare. So to that end, what we did was we used a different form factor. Instead of a handheld device, we're using smart glasses. Now, smart glasses, much like your smartphone, they have the same computing power. You wear it on your face, and best of all, your hands are free. So you got the power of that sort of computing power that you need to deliver technology without engaging your hand. Now, smart glasses, they all kind of share a similar sort of concept. They all have a little camera that sits right above the dominant eye. So when you're looking at the patient, it's as if you're looking at it through the camera with the smart glasses. So it's a point of vision feed as opposed to holding a device with your hand. It's a standalone device. Audio, video communication is all through this. You don't need a phone. It's a Wi-Fi cellular-based device. And most importantly, it has this little heads-up display, which allows the user to basically see what the other person is seeing and navigate the screen as well, and exchange information on that screen. So that's a good way and secure way of communicating information. This cartoon kind of explains it. You put the glasses on, you look at a patient or an object or a screen, the image gets transmitted over a secure cloud to anywhere in the world where the remote expert is sitting on a tablet, computer, or a phone, and they can communicate. The communication, audio video communication is great, but it's beyond that, and we'll talk about it. In this example, you see the person with the paramedic in the ambulance. They're wearing the glasses, dealing with a patient. What they're looking at is projected on the AR screen of the glasses, which they can also see as a heads-up display, so they know what they're broadcasting. And that same screen also is used for exchanging information with the physician on the other side. Like I said, over a secure cloud, this goes to the other side of the world where the remote expert is sitting at a computer, tablet, or a laptop. Doesn't matter what computer you use, Mac or Windows, even Linux, it works. Which phone, Android, iOS, whatever operating system you're using, this is a compatible solution. So we call this the TeleVue IC platform, which is web-based, easy to use, easy to learn. And the software that goes on the glasses is TeleVue UC. So the concept is pretty straightforward. I see what you see. Now, any healthcare setting can utilize this technology. You've seen the ambulance example that I provided, home care, long-term care, surgical settings. We got lots of great examples, stories around that, emergency settings, clinical settings. Most importantly, if you think of it, the person needing expert advice can put the glasses on, and they can have somebody look over the shoulder remotely and provide the guidance that they need. Or the other way around, you have an expert that puts the glasses on, and they provide expertise to the larger audience by, for example, doing a novel procedure so others can learn from it. So this is a two-way communication tool that can be used by the expert and by the person needing expert advice. Lots of flexibility as far as connectivity goes. You can go one-to-one, one-to-many, many-to-one, a few glasses with one expert, few experts with one glasses. You can have patients on a tablet with the clinician work with you as well. And you can have somebody broadcast it to a larger audience, like I said, for everybody to see it either individually or as part of a larger group. Having the glass view was great, but we didn't stop there. So we've now added multiple feeds to provide an immersive view, because being in the room is not just having a view of from the eyes. It's on. There's lots of screens in the healthcare setting, medical setting. There's other things in the environment that is important in the patient care, and you want to be able to capture all of those. So with screen view, we can capture any medical screen that is in the room. So you have ultrasound, X-ray, vital sign, anesthesiology machine, you name it. You can bring it into TeleVue as a feed. If you wanted to see what's going on in the room, you can employ cameras that are already existing in the room or add new cameras to have a holistic view of the room and what's going on in the medical setting or a clinical setting. With that, you can change the screen that you want to focus on, whether you want to talk to the remote expert, focus on the medical screen, or focus on the visual of the smart glasses. That's totally up to you, and you can interact with those screens. Similar settings in a surgical setting, you can change the view from one to another, and you can have multiple views as if you're in the room exactly there. Obviously, with video comes privacy concerns, and everybody's obviously talking about that. So we've basically solved for that by providing facial blurring using our AI algorithm. Our AI engine is called AIView, which not only runs algorithms like this, but it only provides us with other augmented reality functionalities that allows to enhance patient care. Now, lots of different use cases, and this is, like I said, applicable in many healthcare settings: acute care, EMS, long-term care home, proctorship, mentorship, wound care, medical education, biomedical services, and lots more. Like as a small example, like inmate care, there's a lot of problem around that, and they don't have access to great care, and transporting them away from the facility is quite expensive. So there's a lot of information there that can be utilized. Now, I want to highlight a couple of things, whether you're in vacationing in Paris, or having dinner with your friends, or in a clinic in Toronto, or in a hospital in St. Mary's in Kitchener, you can actually use this technology to help patients. And these are some of the examples of how people are using this technology to help patients. This is being used across Canada, US, and internationally. Various hospitals, paramedic organizations, medtech companies, long-term care homes, private clinics, they're all using it. And we actually recently shipped 20 of these glasses to Ukraine. So they're going to be used in the war zone as well. So flexibility and practicality and ease of use, these are really important features of such technology. So I'm going to stop here, open it up for questions, and we can talk about the market size and other questions as you guys have questions. So I invite you to bring up your questions, and we're going to have a discussion.
Thank you, Ryan. Any questions from the panel?
Yes, excuse me. Yes, I have a question. As a health economist, I feel it's my duty to ask you about cost and cost effectiveness. You haven't talked at all about the financial aspects of your technology.
Absolutely. So the way we design, if you remember my first slide, we talked about efficacy both from an operational perspective and from a cost perspective. Just to give you an example, for example, a medtech company that is using our technology, their sort of their sort of business model was they spend more for one clinical specialist on parking costs compared to our technology per year. So it's going to cost you less than $5 grand a year to use this technology for any type of use case, compared to a robot, for example, that costs you $150,000. That's going to limit you to a single patient or a single use case. So that's kind of, in a nutshell, how the business model works, and lots of cost saving have come with this.
Thank you.
Okay, we have time for one last quick question from the panel.
Sure, and thanks, Ryan, for the presentation. Congratulations on all the success thus far. Quick question here. So talk to me a bit about competitive differentiation. There are numerous smart glasses players out there, particularly for surgical procedures. So how is TeleVue different, and how are you building a competitive moat?
Absolutely. So a couple of things I want to highlight. First of all, I come from a healthcare background. I'm a medical physicist by profession, and with IT and expertise. So what I did with this software with my partner, which is also an AI expert, we actually put all the healthcare sort of bottlenecks that we had in mind with the 25 years of experience into this platform. So when we designed it, it was from ground up with healthcare in mind, as opposed to most of the competitors that are IT or sort of other use case companies that are kind of me too now, saying, oh, we have a solution for healthcare, which is not the same. Like ScreenView that you saw, that's a very unique sort of feature that we have. In addition to that, we're utilizing AI in our platform, which is, again, a very important factor. Not a lot of these companies have that. And if they do, it's more on the operational side. We have AI on the clinical side. For example, for diabetic retinopathy, we have an algorithm that allows you to diagnose patients that are, or not diagnose, rather, refer patients to hospitals with 98.9% accuracy. Or for physio rehab and during knee surgery, we can actually calculate range of motion using the same smart glasses that you saw. So there's a lot of AI behind the scene that goes on that differentiates us. In addition to that, it's the ecosystem that we're building. Remember on my first slide, I talked about an ecosystem. So it's not just the smart glasses. We have a remote patient monitoring platform. It's cloud-based, which integrates with this. We have a future patch technology that is coming to the market, and it's going to integrate with the glasses as well. That kind of lends to the market, a hospital at home, and so forth and so on. So it's not just the smart glasses for surgical setting. It's smart glasses and the connected care ecosystem for any healthcare setting. That's kind of where we're going with this technology and how we differentiate it.
Very helpful. Thank you.